Если бы я не попала в госпиталь, то вот этот вот сегодняшний визит, рассчитанный на 7 апреля, был бы обычным плановым визитом после посещения моего лечащего врача. То есть с чего все началось? 10 марта мне стало плохо, у меня был такой достаточно сильный, серьезный приступ, после чего спустя день я записалась к своему лечащему врачу, который, собственно, и выписал мне направление к вот этому гастроэнтерологу, к которому я сейчас направляюсь. По предварительным таким ощущениям, по предварительному моему осмотру, он принял решение, что действительно это имеет, может быть, отношение к гастрологу, поэтому он и выписал мне сюда вот направление. Если бы я не попала 31 числа в emergency call с третьим приступом, с такой сильнейшей острой болью, то вот этот вот поход, он бы, наверное, заключался в том, что мне посмотрел бы гастролог и, возможно, предложил бы сделать мне какую-то гастроскопию, посмотреть, что у меня внутри, что у меня в желудке, почему это происходит и так далее. Но вот сейчас этот визит мой будет направлен на то, что я, исходя из теперешней ситуации, из того, что я уже попала в госпиталь, я там отлежала, отказалась вот от этой операции, точнее ее вообще временно приостановили для того, чтобы я взяла дополнительное чье-то мнение. И вот на фоне всего этого я сейчас к нему иду. То есть тот же самый прием, который у меня был, он остается, он никуда не исчез. Вот я уже захожу сюда, в эту дверь. Так вот, то есть вот это вот мой поход к этому гастроэнтерологу был бы обычным плановым походом. И, наверное, заключалось бы опять-таки все в осмотре обычном, вот, и в том, что он, возможно, предложил мне сделать вот эту вот гастроскопию, то есть глотать вот эту вот кишку, или как она там называется, с камерой внутри, для осмотра, что же у меня там делается с моими внутренностями, что же делается с моим пищеводом, потому что я все время держалась в области вот здесь вот груди и не знала, что мне делать, корчилась просто от этой боли, вот и все. Ну, вот сейчас вместе с вами мы зайдем к нему в кабинет и узнаем, что же на самом деле, вот теперь на фоне уже всего этого, зная мою ситуацию, потому что я думаю, что данные к нему уже поступили. Когда я выписывалась из госпиталя, мне сказали, что ваши данные поступят к вашему лечащему врачу, и в том числе они будут в общей базе данных уже начиная с понедельника. Сегодня понедельник, 7 апреля. И, собственно, я в надежде на то, что эти данные поступили. Хотя сейчас только утро, 10 утра. Может быть, это не точная информация, но все выясним тут уже на месте, когда я к нему зайду. Так, а здесь закрыто. Такой же вход, такое же решение. А вот здесь открыто. Вот я уже захожу сюда, в эту дверь. Подхожу к регистратуре.
So I've got your referral letter.
Yes.
I just need you to complete one of these for me.
Yeah.
So you fill this one in.
Yeah.
And you can bring it back to the executive.
Okay. Thank you very much.
Thank you.
Так, давай здесь сядем.
Сколько будет?
Да, хорошо, да. Значит, мне дали вот такую вот форму заполнить. Сейчас я ее буду заполнять. Сейчас в данный момент происходит мое оформление. Спрашивают, кто я такая, уточняют время моего прихода и предлагают мне присесть. Пока я присела, я продолжаю с вами беседовать на этот счет. Итак, сейчас меня только что вызвали. Я сейчас иду к нему в кабинет, и вместе с вами мы послушаем, что же он мне скажет.
Hi, I'm John Freeman. How do you do?
Nice to meet you. I'm Valerie. Yeah.
Okay. All right. So, young you 52,
Yes,
and you married.
Yeah.
You got children.
yes, two children.
And are you working?
Not at the moment.
What's the problem you're coming to see me about?
Yeah. The problem started 10th of March. During the night time, very strong pain at this point. Vomiting. A little bit better, and next morning we go to the GP, and GP created a referral for you appointment, set appointment to you on this date. But after this couple of days, another strong pain, and we go to the hospital. 31st of the March, at the night time, young girls went to the hospital, Southern Hospital, with strong pain. In hospital, after lots of the blood tests, scanning, they said that they found the source of the problem, and 99% of the problem, 99%, that's the gallstones in the gallbladder. And they suggested to go through the operation of removing the gallbladder, and they thought that solved the problem. But because the pain is gone, and Jana is very doubt if the operation is still necessary. So some talks to the surgeon there, and decided to take some interruption, like for thinking for Jana. That's why we are here, and we have some questions about this condition.
Sure.
And
So when she was in the hospital, did they do an ultrasound?
yes,
And the ultrasound showed gallstones.
yes.
And was she tender over the gallbladder? When they examined her, was she tender over the gallbladder when they pushed?
Yes, it's
Yeah.
correct. Yeah.
And who was the surgeon that saw her in the hospital? Do you remember?
I don't know.
Okay, but they advised that you have your gallbladder removed.
Yeah.
Okay. You've had 2 attacks.
Yeah,
Three.
maybe 3.
3 attacks. Okay. And when you have an attack, how long does the pain go on for?
Last time start from 9 and finish like 2 or 3 a.m. Like
Okay.
5, 6
Yeah.
hours.
And when you went into the hospital, did they say that your liver function tests were abnormal? The liver blood tests were abnormal?
Yes.
I think so, yes.
They did maybe 2
So
or
that
3.
was at Sutherland.
Yes.
Can you get access to this?
Have you got a discharge summary?
Yes, yes.
Where is it?
Last Wednesday. not
Hi.
Wednesday.
Can you chase up, see if there's a discharge summary for Jana when she was in Sutherland Hospital on the 31st of March?
And discharge.
Especially her blood tests. Okay.
Discharge
Yeah.
second to Friday. Second to Friday.
What's that? Okay. Yeah. Well, yeah, maybe I'll need both because I think she had an ultrasound as well. Yeah. Okay. Thanks. Bye. Yeah. Okay.
2nd of April discharge.
Okay, so you were in hospital for
31.
Like 3 days.
3 days.
Yeah.
Okay. And the surgeons were saying you needed to have your gallbladder up.
But the problem, I think, that because she didn't go to the toilet,
Like 7 days.
7 days.
Yeah,
Okay,
maybe.
So you're a bit constipated.
Yeah,
Yeah.
that never happened before. Never, because when we went to the hospital, they say no more eating, just the
Medicine.
Yeah.
and
yeah.
no eat at all.
Okay.
Maybe that they cause the problem. I'm not sure.
And have you had any other medical problems or not?
Not.
Any operations?
No.
Allergies
No.
to medications? Do you smoke?
No.
Drink alcohol?
No, zero.
And is there a family history of gallstones in your family?
I don't know.
Okay. And you haven't had any trouble with the heart?
No.
No asthma,
No.
tuberculosis? Your bowels generally, are they okay? Normal?
I think so.
Yeah, no bleeding?
No.
No, nothing.
Urine's okay?
Yes.
Periods normal?
Yeah.
Do you suffer with headaches?
Yes,
Yeah.
sometimes.
And what do you take for those?
Two headaches problems. Front pain, sometimes, and 2 or 3 years ago the back end pain because of nerve
Like blocked nerves.
block
Yeah.
nerve.
Okay. And do you have arthritis?
What's
Yes.
that?
Inflammation of the joints?
No.
Okay.
Excellent.
Okay. So, Yana, can I get you to maybe slip off your top, just lie back on the
Oh,
couch?
okay. Yeah.
And I'll come in. How long have you been in Australia for?
Oh, like 25 years.
Well, long time. So where did you come from?
I'm from Moscow.
Moscow, you say?
Yeah. Просто на меня ровно наведи и пускай она снимает. Так.
Okay, just keep it nice and still. Stick out your tongue. Good.
Oh, yeah. Like pain, start from here, like this one, this area.
Yeah. Okay. Good. And I'll get you to sit up.
Yeah.
Breathe in and out. In. In. Good. Okay. Come and pop back down
Okay,
again.
yep.
So, everything on examination now is normal. Your blood pressure is a little bit up, but sometimes
How much?
it was 170 on 90, so it's high.
170?
Sometimes, yeah,
Oh my
if
gosh.
you're going to the doctor, it can go up. When you just check it with your GP a couple of times and make sure that it's okay.
Because my normal is 110, 120.
Yeah.
Yeah.
Yeah. I think
170 it's so
probably
high.
what we call white coat hypertension. Just sometimes when you come and see a specialist, it will go up.
Could it be because of some medication she got in the hospital, and it's just aftermath of this?
I don't think so.
No.
No. So now let's get back to the gallstones. I'm chasing up the results to make sure, but from what you tell me, the ultrasound showed gallstones and inflammation of the gallbladder, and the blood test confirmed that. You've had 3 attacks of similar, and I think the advice you've been given is 100% correct. You should have your gallbladder removed.
They say pancreatitis. Acute pancreatitis.
So she had pancreatitis.
Yes.
With the last attack.
Yeah.
Okay. And and you understand why she had pancreatitis?
They said that caused the gallstones in the gallbladder.
Well, sometimes the little stones can come out of the gallbladder and go into the bile duct, and the pancreatic duct opens at the same spot. And if the stones get stuck here, you can get pancreatitis.
I think that's what happened.
Yeah. So all of that tells us that she's got symptomatic gallstones. If we do an ultrasound and we just see gallstones, but someone has not had an attack of either inflammation of the gallbladder or pancreatitis, then we would not recommend having the gallbladder out. But once you've had one attack, as a confirmed attack, the chances that she will get more are high. And so that is why it is advised that she have the gallbladder out. Because 2 things. Attacks of pancreatitis, you can have mild attacks, and if she got out of hospital in 3 days, that was a relatively mild attack. But pancreatitis can be a life-threatening condition where you can get very sick. And I have no doubt that the correct treatment for her is to remove the gallbladder.
You think that's the only solution?
Yeah, because...
No any medication approach?
No. So in years gone by, there were drugs that could dissolve stones, and people tried that. And what happened was, number one, you had to take the drugs for up to a year. They tasted awful. Patients hated them. But the big problem was the moment you stopped the medication, the stones came back, because whatever caused her bile to be oversaturated and form gallstones hasn't been corrected. So you can dissolve the stones, but then the problem will just come back when you stop the medication. And it wasn't the type of medication that you could stay on long term. So,
But if say I will take the medication constantly without no interruption.
Yeah. To be honest, I don't even believe the medication's available anymore for clinical use.
Dissolve.
Yeah.
Medication is not available. So
No.
Why is it stopped?
No one uses it, so the people don't manufacture it anymore because it's not the answer. I think for her the correct treatment is to have the gallbladder removed.
Question. Gallbladder removing these green things, right?
They would cut off there and remove the gallstones, but
but
at the time of the operation, they will also examine the bile duct. They do a cholangiogram because we want to be absolutely sure there are no stones that have gotten out of the gallbladder into the bile duct, because if you don't clear those stones, you can have problems as well.
But if the stones is here, so they should remove it. But maybe operation should remove just this one and not remove the gallbladder. Because gallbladder at this point it doesn't cause the problem. The problem is because of that one.
Yes, but once she's had some stones coming out, she's likely to get more. So you can remove that one, but then the issue that caused the stones to go in the first place will come out. Sometimes they do an operation from inside where you make a cut and you widen the opening, And so that means if stones do come out, they're more likely to pass without causing a problem. But if she was 80, 85, had lots of medical problems, then sometimes you would just do that to fix this problem and you would leave the gallbladder. But in someone of her age who's otherwise in good health, the better treatment is to remove the gallbladder. And you don't really need the gallbladder. It's very rare that people get any side effects from having the gallbladder removed.
Yeah. So
Occasionally, but even that you can fix with medication. So, and the operation's, pretty straightforward. Not in hospital for more than a day or two. So, is she scared of the operation?
yeah,
Or?
she's scared, and she also thinks about the side effects and afterwards. So about the consequences of this.
Okay, look, the only thing I can say is from, experience of the condition, the benefit risk in her situation is very much in favor of having the gallbladder removed. Because no point in being scared of that if then 1 month later she gets terrible pancreatitis and gets very sick.
Yeah, in question, because you remove this one, all the gall goes not here but directly to this one.
Yeah.
And
yeah.
this surface.
Yeah.
What was it? The stomach or what is this?
The duodenum, the small bowel.
Yeah. So, and lots of the gall goes here.
Yeah.
And the gall is very toxic, very like exit liquid, which is cause some problems with the surface of these organs.
No, that's not right. So look, the only reason for having the gallbladder is if you have a big fatty meal, then the gallbladder can contract and release the bile, which helps to digest the fat. But if you're just trickling bile down, then that's enough for digestion. You don't really need the gallbladder. In people who get diarrhea from the gallbladder, and it's a small percentage, what happens is because bile is trickling down all the time without food, occasionally when the bile goes all the way through the intestine and lands in the colon, the bile can irritate the colon and then people can get diarrhea. It's not causing any damage here. But if that happens, if you give a bile binding agent called Questran, which we use to lower cholesterol, it binds the bile so that when it gets into the bowel, you won't get the diarrhea. So it's quite easily fixed. But I think the rare side effect of that diarrhea is minimal compared to the risk of not taking out the gallbladder.
But in this condition, like right now, when no pain for Jana, if say Jana follow some diet and not eat some irritation food for the stomach, and pancreatitis, so maybe we still can wait, or how do you think?
Look, there are some people who have a few attacks and they change their diet and they have less fat and all of that, and it's possible she may not have further trouble, but in my opinion the risk that she will have further problems is much higher. And I wouldn't be recommending changing the diet as this treatment, because if she got a bad attack of pancreatitis and landed up very sick, you wouldn't be thanking me for that advice. So I just think you've been advised by the surgeon. Good to get a second opinion. To me, whether she has the gallbladder out or not, it's not affecting me in any way. I'm not doing the operation. But my independent advice would be the risk benefit ratio in her case favors having the gallbladder removed. And there's no point in being a bit afraid of operations, but she should be more afraid of the complications if she doesn't do it. If that makes sense.
What complication could be?
Well, she can get cholecystitis, inflammation of the gallbladder, if the stone gets blocked here, or she can get pancreatitis. And she could get mild pancreatitis like she had, and land up in hospital for 3 days and then come out. That's not the end of the world. But occasionally, if you get severe pancreatitis, that is, a different ball game. People land up in hospital for months and very seriously sick. So I wouldn't take the chance. Okay.
Yeah, and question.
Куда будет стекать вот эта вот желчь, которая да, хорошо, но если они удалят вот этот вот кусок, да, смотри, они его удалили вот здесь. Дальше у меня, значит, все пошло по протокам, спустилось сюда. Здесь заблокировано. Они решили эту проблему. Но ведь эта проблема, она осталась.
Они будут проверять. Он говорит, что когда будет операция, они проверят, если есть.
Так, теперь...
So are you sure that during the surgery, not just removing the gallbladder, but also removing all the stones if they are presented?
Yeah. There are two ways that you can do that. Sometimes, and I don't have access, I don't know what exactly was shown, but sometimes you can, before the operation, she could have an ERCP where...
Scanning.
No, it's called ERCP, where the doctors put a tube down into the stomach and the intestine.
Like pipe?
Yeah. And then where this opens, they can put a catheter in and they can inject dye, and the dye can tell you whether there are stones. And if there are, they can put a basket up and they can pull the stones out and they can clear the duct. That test itself, the actual test, has about a 1% chance of causing pancreatitis because they're going in at this point, and if you get swelling there, you can get pancreatitis. So it's not without some risk, but the same time as the surgeon removes the gallbladder, they can put a catheter in and put dye into there, and they can tell if there are stones, and if there are, they can remove them. You follow?
А как часто вообще нужно наблюдаться? Если, допустим, меня сейчас будет беспокоить время от времени, как часто мне нужно проходить, например, вот этот ультразвук, или после операции? Надо ли мне вообще вот раз в год там?
Are there any special care after the operation? So she need to take scanning every, say, month, year, or no?
No, nothing.
So just operation, say goodbye and forget about this for the rest of the life?
Pretty much. Much.
Nothing special, any special care, nothing, no medication.
No. For 99% of people, there's a small chance some people get, diarrhea that they will need treated, but for most people, no. You don't need follow-up, anything like that.
So you think the medication for splitting the stones, dissolving, it's not a good approach for the solution?
No,
it's not a solution.
No, it was something that was tried 20 years ago, had a short period where it was used, and then it was shown to be useless and not tolerated from the patients. So it impaired the quality of their lives while they took it, and then it all came back. So not the answer.
Если это не удалять вот сейчас, сколько времени есть на то, чтобы как бы подумать?
If say Yana thinks don't touch at this point,
yeah.
How many months or years she have for the some life, quiet life, diet life?
Completely unknown. She could go a few years and not have any trouble. She could have another attack tomorrow. I can't tell.
So nobody knows.
Nobody knows.
А все-таки вот эти вот капсулы, кислота по рассасыванию желчных камней.
Нет.
То есть в Австралии этих лекарств нет?
Again, get back to the medication for splitting the.
Yeah.
It's not exist in Australia completely.
To be honest, I don't think I have not seen anyone use it for more than 20 years.
Yeah, but I think it's very not popular here. But maybe
No.
it should be presented to some.
I don't know, to be honest, that it's used anywhere in the world. I really don't.
I think in
it is.
Germany.
Yeah.
In Germany, yes.
Yeah.
Not here, so it's
But
not
not something that anyone uses here, for the reasons that I've given you.
Так,
But-
а что касается диет, что прицельно можно, а что прицельно нельзя?
Таблетки свои покажи, если хочешь.
Да, кстати,
покажи,
относительно
достань.
таблеток, да.
Yeah.
About the diet.
Yeah, that tablet reduces acid and is for ulcers or reflux problem, but that will have no effect on the gallbladder.
But for the pancreatitis, you say
No effect on the
she
pancreas.
feels
No, it won't affect that or help
Okay.
that.
Так, а если заболит, их можно пить или не
If she
нужно?
feel again pains out here,
Yeah.
don't use it. It's not.
I mean, look, sometimes, you know, there can be overlap between a bit of reflux and indigestion and heartburn. So, you know, if she's getting a bit of reflux or indigestion, that tablet will help, and that's probably why the GP got it. But her presentation to Sutherland Hospital showed that the major problem was the gallstones. That's not going to help the gallstones.
Ну, а ведь мне их вводили внутривенно. Вот этот препарат мне вводили внутривенно каждый день.
You understand, when she was in hospital, this medication they put in the injection.
Yeah. Look, because in the initial stages, until you establish what the diagnosis is, you're trying to cover everything in case
Okay.
she had an ulcer or something else. So they're giving her that. But in terms of that helping the gallstone problem, no.
No, it's not.
No.
Not relation.
Yeah.
Так теперь по поводу вот этой боли внизу, ты будешь констипation?
Да нет, по поводу того, что вот во время операции сказали, что будут выпадать зубы, это так?
Another question. So she spoke to someone in hospital, and she was told that after the operation could be problem with the dents. If they remove the gallbladder, to
Could be a problem with the
dents. So some dents can be just bobbling and dropping from the
teeth.
Yeah.
The tips, so not
Yeah.
tips.
Yeah.
Is it correct?
No, look, the only thing, if she has an operation, only if they put a tube, the anaesthetist puts a tube in, then they have to actually, you know, give you all the lists of complications. So when they put the tube in and they use an instrument to go in, very rarely, you know, they can damage the teeth.
That's only during the testing.
Yeah, only during the procedure. So if the anaesthetist is putting a breathing tube in, you know, very rarely that can affect the teeth. But, you know, it's not that's a complication of any anesthetic, not the gallbladder per se. Okay.
Так, и последний, наверное, вопрос. Вот если человек ничего не делает, не операция, ничего, просто вот так вот ходит, и случился какой-то приступ, да, будут приступы, понятно, но может быть какой-то критический приступ, от которого человек может даже умереть, то есть там все заблокировано, эта желчь пойдет куда-то не туда, и человек может просто умереть.
So if they do nothing at this point and just strictly keep the diet, is it possible that in the future there will be some very strong critical attack that can be life-threatening?
Of course, that's a possibility.
Possibility.
That's why, you know, I would recommend she has the gallbladder out. But you know, whether she definitely will have that, you know, can't say for 100%. When it will happen, can't say. But the overall experience, you know, of physicians, surgeons, will advise you that in her situation she's better off having the gallbladder removed. At the end of the day, she's the boss, and if she decides she doesn't want to do it, well, then fingers crossed she'll be all right.
Yeah.
Yeah.
All right.
Yeah.
I'm not sure there's much more I can say, but my secretary has sent a fax to the hospital. If I get the records and there's something different, I will ring you.
Okay.
All right.
Yeah, thank you. And maybe a few last questions about the constipation. So
Yeah.
maybe you can prescribe some,
Look, probably
or just wait.
Yeah, look, if it's all settled down, she probably needs nothing. If it sort of comes back, a good sort of combination is Metamucil, which is a bulk forming agent. So it's not a harsh laxative that will make her bowels lazy.
Medication.
And then Movicol is just a sachet that you dissolve in a cup of water and adds a little bit of liquid to the stool, which helps. Both of those are kind of safe and easy to take. She could just use those.
Which one is better?
Doesn't matter really.
Similar.
If the stools are very dry and hard, then the Movicol.
Okay. So it's not. We don't need the prescription to
No,
put. So
just over the
go to
counter. Just over the
show
counter.
this and they.
Yeah.
Well, and constipation is very bad for in this situation, or is
No,
no.
it's not. They're two separate issues. They won't complicate each other. All right.
Okay, thank you.
Okay.
Thank
Can,
you.
can you take this one?
Yeah, sure.
Okay.
Here you go.
Okay, thank you very much.
All right. All
Yeah.
the best. Good luck.
Okay.
I will send a letter to your GP.
Okay. Ну что, я только что вышла от гастроэнтеролога. Вы все сами прекрасно слышали, хотя, в общем-то, у нас не было здесь переводчика, мы сами себе и говорим по-английски, и сами же переводим, но, в принципе, наверное, многим непонятно из того, что было сказано, потому что речь шла на английском языке. Напомню, что все дело происходит в Сиднее, Австралия, здесь ходовой английский, но, тем не менее, меня смотрят из многих стран, не только из России, хотя у нас в России тоже уже половина наших граждан понимает прекрасно английский язык, и не только его. Вот, поэтому многое, в общем-то, из этого, конечно же, уже понятно. Понятно по ходу того, что было со мной, что есть на данный момент, и вообще, как мы обсуждали эту ситуацию. Вот. Но в двух словах, если быть точным, для тех, кто не понял, в чем суть, я могу сказать, что нового, в принципе, он, наверное, мне ничего не сказал. То есть он посмотрел мою историю, выслушал меня. Кстати, данные почему-то так и не поступили. То есть они есть, но в каком-то минимальном объеме. То есть все было с моих, опять-таки, слов. Вот. И, собственно, этот разговор, наверное, может быть, и ни к чему не привел. То есть он выявил действительно то, что уже выявили у меня там в госпитале, обрисовал мне общую суть, сошелся на том мнении, что действительно, наверное, все-таки стоит удалить этот желчный мешок. Почему? Потому что он все равно, рано или поздно, он себя так или иначе будет проявлять. То есть все равно у меня будут появляться время от времени эти приступы, все равно я буду ощущать эти болевые ощущения. В общем, я, честно говоря, даже не знаю затруднений, что делать. То есть это еще одно мнение, которое я выслушала, независимое мнение относительно моей ситуации, потому что, уходя из госпиталя, повторюсь, мой же лечащий врач и также хирург, они мне предложили следующее, что мы вас сейчас выписываем, но только с той целью, чтобы вы взяли такую паузу, тайм-аут, для того, чтобы немного охладеть, отрезветь от этой ситуации, то есть прийти в себя, осмотреться по сторонам и, может быть, взять независимое мнение еще от каких-либо докторов, потому что, конечно же, остались вопросы, остались сомнения и так далее. То есть независимое мнение еще чье-то, оно все равно сыграет в мою пользу так или иначе. Но вот это мнение еще одно я выслушала, и сейчас вот иду домой, опять-таки буду все это осмысливать, думать, что же все-таки делать на самом деле, соглашаться на эту операцию или нет. И вот поскольку у меня уже был визит у GP, у меня был визит у этого гастроэнтеролога только что, следующий мой визит, он назначен на эту пятницу, то есть это получается уже спустя почти 2 недели после того, как я вышла из госпиталя, на эту пятницу, на 11 число, на час дня. Собственно, я обязательно приду на эту встречу, потому что эта встреча, наверное, будет такой решающей, заключающей в этой истории, очень важная для меня. Она будет, наверное, таким заключающим моментом, потому что в любом случае нужно поставить как бы какую-то хотя бы точку и уже двигаться дальше. Поэтому на этом пока у меня все. Ждем пятницы, ждем следующего визита к хирургу на основе вот этих вот дополнительных мнений от моего лечащего врача и от гастроэнтеролога. И увидим, что же мне скажут дальше. На этом у меня все. Как всегда, я желаю всем счастья, здоровья, не болейте, берегите себя, берегите своих близких. И увидимся с вами уже в эту пятницу. Всем пока!